everyone, welcome to Coproduce Care, Chat for Care, series of live streams that we're doing to explore what's going on in the social care sector and also involving healthcare where that overlaps. So today I'm really excited to be joined by Skills for Care. We have Oonagh Smyth who'll be with us, and she's the CEO of Skills for Care. And of course, we have actually heard from her before, and that was on a panel where we were talking with Martin Green and others. But today, it's all about the State of Care report, which is all about data. So slightly different from what you'd hear from CQC. This is all about data focusing on the social care sector. So we'll be talking about the different things that they've uncovered, the themes, the issues in terms of gender differentials, pay, and we'll really be exploring all of those different things. So do hang on with us, do check out what we're doing, as always, if you're watching us on YouTube, make sure that you follow us on YouTube and subscribe to our channel. And if you are on Facebook, then don't forget to like our page and encourage other people to come along, because actually we've got so many things that we're going to go through today that it's going to really enlighten people about how much information there is being collected on social care. And I often say to people when they say there's nothing on social care, we don't know about it, it's kind of too disparate, it's too fractured, but actually there's quite a lot, and Skills for Care pulls that all together amazingly. And what it does, it really highlights some of the issues which don't necessarily get explored. So we're going to look at the data, what it means, what it's saying. Some of it won't be surprising, but also the really useful bit is how managers, care managers, how local leaders, how national leaders can really use that information, which is gathered from thousands of providers and covers so much of the workforce, how they can use that to plan what they're doing within social care, plan their organizations, how they're recruiting, benchmark themselves against other organizations in their area. And also, I'm also a care manager alongside kind of doing all of this, taking a bit of a step back from that to do more of this. But I was quite surprised at how accessible their information is and that's on their website. So we're going to kind of explore that a bit more. We're going to look at it in more detail, but I don't want to give everything up straight away. So I'm going to pass on, I'm going to introduce our guests in a moment. But before I do, just so you know what's coming up for us, we a bit of a hangover from Black History Month, which was in October, but we are going to be interviewing I'm in Bristol, so it's our local mayor, Asha Craig, deputy mayor, and she's going to be talking about some of the things that have been going on in social care in the city, how they're supporting non-white groups who are working in social care, but also more about the community. So how Bristol's been really looking at supporting community groups and supporting them to not only deliver care, but also support people in the community. So do subscribe to our YouTube channel to find out when that is live. The dates are there, but also you'll get a notification if you subscribe and click for a notification. So that's enough about what's coming up later. And I'm going to introduce Oonagh to the stream. Hello, Oonagh. How are you today?
Hi, Sophie. I'm really well. Thank you for inviting me. This is the second one I've done, I think.
Yes, I know. Thank you so much for engaging with us. And what I love about these live streams is that even if, normally we do them in the evening, this time is in the day when people are really busy, but people can watch them back and they can really reflect on the information. So, and it's just there in the ether forever. So it's really great that to have you on and explore the report that you've brought out recently. So maybe you can maybe just introduce Skills for Care a little bit for anyone who doesn't know, and then talk to us about the report and what it says and the key themes that you've taken from it.
So Skills for Care, thanks, Sophie. I was just reflecting on the last session that I did with you. I was only just in post, whereas I'm in a little bit more now, so a little bit longer now, so I feel like I know a bit more. So Skills for Care is England only, and it's the workforce improvement body in social care, employer-led, and a key strategic partner for the Department of Health and Social Care, so the department's delivery partner. And I think what we do is a combination of support standards, guidance for employers around recruitment, development, leadership training, and we also develop and gather a lot of intelligence about the sector. So some of that we'll talk about today. I mean, there's so much in there that you could spend weeks talking about it. So that's our quantitative information. So we gather all of that and report on it, and then we also get a lot of market intelligence from the sector. So where are people? What's happening? What does that mean? And feed that back as well. So yes, that's us.
Brilliant. And that's really actually useful, because a lot of time I think people don't really know how to position skills for care. So it's that in a nutshell is really, really helpful. So what I was hoping to use the time today to give you a chance to go into your key highlights of the report, and sort of, how it's done, who it involves, because actually it's collected from the data set that you collect. It used to be called the NMDS, now it's called the Adult Social Care Workforce Data Set. So it's, I feel apart from the information that the CQC collects from providers, that really is the next step in terms of gathering information from so many registered managers and their organizations. So if people are thinking about legitimacy of data, it's actually really comprehensive. Yeah. I mean, in terms of numbers, how many organizations does the data in the report represent?
So it represents 675,000 individual worker records, and covering 20,000 care locations. So about half of the sector really, and is, in terms of the standard of data, it's government digital service standard. So really robust, really, really reliable.
Great. And what we'll do is we're going to speak to one of your colleagues, Dave, later, and he's going to go through what a bit more, crunching the data, if you like. But maybe you could sort of spend the first sort of 5-10 minutes going through your main highlights. I know we've got a few overlays on national statistics and pay statistics and things that we can bring up as you go along. So yeah, over to you for a bit.
Brilliant. Thank you, Sophie. So yes, as Sophie said, we really want to talk about how much the data that employers contribute to our data set matters at 3 levels, really. So national, local and employer level. And as I said, just there to Sophie, that covers 675,000 workers' records over about 20,000 care locations. And that gives us a real direct insight into what's happening in our sector. And we use that to create 2 annual reports, as well as information that you can access at any time of the year. The first report is the size and structure of the adult social care sector and workforce in England. And then there's a more detailed state of the annual social care workforce in England report. And that was just released in October. So those reports really give us a detailed insight into the size of the workforce. So if anybody's wondering, we have about 1.5 million people working in social care. They talk about things like the age profile of the workforce, and with about a quarter of the workforce potentially retiring over the next decade, that's a really critical piece of workforce planning information. The report also tells us that around 80% of the workforce is women, is female, and that also gives us a sense of how much people are paid, their ethnicity, and other key indicators for the workforce. So what this allows us to do in terms of all of those records and being able to crunch some of the numbers of people that are far more talented than me, but it allows us to say things like, we know when people are paid more, they tend to stay longer. And in terms of employers who invest in learning and development and needs of their workers, the more you invest, the more people get trained, the longer people stay. So there's, as well as having some of that sense of the sector overall, we also can get a sense of some of the predictors in terms of what makes people stay in organisations and what makes them leave. And later on, Dave Griffiths, my colleague, will look at some of the numbers in more detail. But the 2 big ones that stand out for me are firstly the number of vacancies in any one day, which we used to say was 122,000. This year's report has shown a slight decrease to 112,000 vacancies. But if we think about that, that's 112,000 vacancies in any one day in social care. So that's a substantial number of vacancies. And we also know from our information that around 2/3 of those vacancies are filled by people moving around the sector. So it means that people aren't necessarily always leaving social care. They like working in social care and want to stay. So that's useful to know, but it still means that we need to fill thousands of vacancies every day. And that has a real impact in terms of the pressures on the system. And the second figure that you'll see there that I use quite a lot is the number of job roles that we're going to need based on demographic changes that we're predicting. And that's the figure that we're going to need by 2035. So an extra 520,000 people working in care by 2035. And obviously that really matters, that information really matters, because it helps government locally and nationally understand supply and demand. And what those two figures are telling us is that we have a significant gap at the minute between demand, so demand for social care, and supply, so in terms of the workforce. And if we didn't know this, then we couldn't create solutions to finding and keeping people, and we couldn't have a long-term approach to that. So we, as Skills for Care, use this information. We make it openly available so that anybody can access it, because we think that's really, really important. We've used it to give evidence to the Health and Care Social, or the Health and Social Care Select Committee, to the Social Care All-Party Parliamentary Group. We've used it in conversations with ministers, shadow ministers, other national politicians and local politicians. And we think this is so important that all of our policy decisions are based on the highest quality information. It's also quite important that our data covers a number of years. So not only can we see what the state of the sector is this year, we can compare that to other years, and then that allows us to see the various trends. One of the other pieces of research that we've done that I think is really valuable to flip the narrative sometimes around social care is the research which shows that our sector delivers around £41 billion to the English economy, and that's growing. So we're a growing sector. And that's a higher spend than the oil industry and the arts industry in the UK. And sometimes we don't talk about that. When we think about the tough times that are coming in terms of the full impact of the pandemic on the economy, I think we need to be making our case that the sector is going to play a really key role in national recovery, as well as the direct impact that our sector makes in our communities every single day. And that applies at a national level in terms of the 41 billion, but it equally applies at a local level. And we know that the vast majority of that money is spent locally. So that might be workers spending their wages in the areas that they live, or employers spending with local suppliers or services. But flipping that narrative so that social care isn't seen as the drain on scarce resources, that it's actually a really key part of local economies. And I think that could be helpful. So just to almost remind people that none of these insights would be possible without people giving us your information about the workforce, and that's really valued. But we also know that relationship absolutely has to be two-way. So that the information that we hold can also help employers at that individual level to understand some of the ways that you can prevent high turnover, you can focus your workforce strategy, you can understand where your challenges might be in the future, and you can use that to link to the support that we provide for employers so that you can prevent some of that happening. So just thinking about one of the statistics that Sophie shared on Twitter in advance of this event. So the 82% of our workforce is female. So just thinking at an individual employer level, is there an untapped employment market in terms of trying to attract more men into roles? What would that mean? What might that look like? And Dave's going to go into more detail in terms of how thousands of care providers use the the Ask WDS service in the day-to-day running of their businesses. And I won't go into that, but one of the key aspects of that is being able to benchmark your organisation against other local providers in key areas like pay and turnover, and helping employers understand your own workforce in comparison with the local picture can help you see whether some of the things you're experiencing are because of the local context, or whether it's actually something that is in your direct control. So if your turnover is higher than the average in your area, is there more that you can do? Are you paying slightly less than the local average, or slightly more, and you want to use that in your employer marketing? Are you training less or training more than others? And that really helps you target your strategies and be, I suppose, competitive, keeping quality people and thinking about how you match that with your local context. So I'm just going to end by thanking everybody who uses the Ask WDS service. And for those who don't, I'm going to make another shameless plug that you seriously think about doing so. We know that having quality data has really influenced thinking nationally and locally, and it's also helped employers think about where your business is. And if every single person who watches this session goes away and has a look at the data that we hold in your local authority area, that would make my week. And I really do believe that data has to drive our thinking and planning. So with that in mind, I'm going to hand over to Dave, who leads our workforce and intelligence team. People always find his bit more interesting than mine because it gets into the detail.
Oh no, I thank you, Oonagh, for that. It's great to kind of highlight some of the main takeaways from the report, and it's a report that comes out every year, but I feel this year it's almost like more relevant because even though there's data overload in lots of different areas, this is stuff you could actually use to help champion discussions that you might have with local authorities in terms of how we pay staff, what support that we need in order to pay staff right, because we can benchmark ourselves not only with other providers in the area, but with different localities. Because I think sometimes people think that the information that is within social care sector within different areas is very regional, and nobody really knows what anyone else is doing, and there's no way to do that. But actually, on your website, people can go on and they can see, well, what is I don't know, Lancashire or a certain area doing in terms of paying their staff compared to Dorset or somewhere else. And you can do some direct comparisons, and if you're in Dorset and Lancashire's doing something different and you're having issues that they're not having, you could say, well, maybe it's because of this stuff we're not doing. So you can take that in those discussions to your commissioners to say this is what we feel needs to change, and this is the data behind it, which I think sometimes as a provider you feel disempowered because you just don't feel like you've got that available to you.
Yeah. And it's really accessible information, so you can go into any local authority area. So I'm in Haringey at the minute, and I can go in and look at Haringey and get a one-page snapshot in an infographic, and then I can dig deeper. I can do some comparisons with different local authorities anywhere. So you're right, you can get that national picture, and you can look locally as well, and then you can go down. Obviously, if you take part in the service, you can go down to that individual level as well in terms of your own pay rates and how they compare. So it can be available up here, and then you can drill right down, which is incredibly helpful.
And it is useful that way. And as a provider, do you have to pay in order to upload your information onto the adult social care data set, or?
No, absolutely not. So Dave will talk about this in a bit more detail, but a lot of employers, one of the reasons they value the data set so much is because it offers them an ability to do things like track their training of their staff. You can put reminders in so that if you've got mandatory training that people need to complete either during induction or they need to do it annually, you can populate the system so that it flags and reminds you. You can pull reports for CQC inspections really easily. So it has a lot of other benefits. So even if it didn't provide data at this national level, I think employers would still find it incredibly helpful as a service. And we're also very user led. So Dave and the team are always talking to people who are using the service and saying, is there anything we can add? So the benchmarking feature came out of some of those conversations where people were saying actually it would be really helpful if we could see what we're paying in comparison with other people, and that's all anonymous, so nobody knows that it's who's paying what. So it's just at an anonymous level, but so we keep adding to the service in terms of what's useful, and because it does have to be two-way. You know, what we're getting is an ability to get representative information across the sector so that we can really get a picture of what's going on. But employers are so busy that we have to make sure that it's a really good use of their time. And so having a service that feels like a service that we're offering is really helpful. So there's absolutely no charge at all. And the only people that have to fill it in are local authorities. So local authorities have to, but other people do it because it's helpful. It also gives you access to the Workforce Development Fund, which we administer on behalf of the department, which covers some of the cost of your training. So that's another big driver for employers as well, I think.
Absolutely. And so you said that the data represents around about half of the care provision. What is the other half that's not engaging with that? Do you think that's non-regulated services? Do you feel that maybe they're just not as aware of the benefits they can get from taking part in this?
So Dave's probably better to answer this one than me, but we weight the data so that it's representative of all elements of the sector. Dave, do you want to pick up that?
Yeah, I will come to Dave. Yeah, with that actually, but that's fine. That is good. I'm just wondering how we get more people using it, because I think it's a great way of getting data. And because a lot of the time when you're asked to give data as a care service, you're either asked for it because somebody's doing it for research or some consultancy firm or something else. But actually, this directly does help us do things within social care. So it's a really trustworthy way of handing over data that can support the report like this. And I know you've kind of like put in 3 different areas how we can use the information. So nationally, in the community, and also individual employers. So we'll come back to that in a second, I think. But we'll give you a break for a bit. Have a drink of water, cup of tea, and we're going to have a chat with Dave. So thanks so much for now, Oonagh.
Thank you.
Hello, Dave Griffiths. Hello, how are you today?
Yeah, I'm very well, Sophie. Thank you.
Good. Thank you for coming on. You're going to help us crunch the numbers and also go through a little bit how to use. We've got some overlays, we call them, but like screenshots of how to use the site. And that's how to get onto the benchmarking, isn't it?
It's showing a sort of a range of features that are available to care providers who use the adult social care workforce data set service, because we're kind of aware that supplying data isn't a care provider's #1 thing they want to do. So while we hope they understand it's massively valuable to the sector to help us understand what's going on in the sector, we do build features that we hope are useful sort of on a day-to-day basis within their business.
Great. So we're gonna go through that in a bit. But first of all, did you want to just go through? Actually, let's start with that. With the benchmarking. Let's start with those. With that, and actually go through with providers. Maybe just recap why it's quite useful and how they might get on to using it on the website. And I've got my colleague Tobias in the background that will pop up some screenshots for us. So do you want to just kind of introduce the benchmarking side of it, and then we'll go through how people kind of sign on and get using it?
Yeah, I can talk about benchmarks and 1 or 2 of the other features that are in the service.
Great, thank you.
As Oonagh alluded to, it's used by around 20,000 different care locations. We've got data on 675,000 staff records, and we speak to our users every fortnight. We have 6 or 7 user research sessions where we're just speaking with users and finding out what they value about the service. So it's very easy to use, has a good user experience because we share all our designs with users. And so we've got a very simple login page. Don't know if you want to pop that up at the moment. So, and you'll probably recognize this because if you use any .gov service, we're using the same sort of design patterns, so it should be very intuitive for users to use, and that is what they tell us. But once they're in the service, they'll land in the homepage area, and from there, they can either be updating their data by clicking on staff records or workplace, or in this instance, you can see there's a flag over training and qualifications, and this is part of the service that's really valued by users. It's where lots of care providers store all their training and qualifications information, so they can quickly access it. If they're having a one-to-one with someone, they can quickly get an overview of the training and qualification that work is done. Equally, we're showing you where training is expired, so perhaps your fire safety training needs updating. We actually also give you an amber flag, so we give you a 90-day warning of this is a piece of training that you might want to update over the next 90 days. Or equally, we can show where training is missing. So if, for example, you've said all care workers at my workplace should have autism training, we can see which care workers have and haven't got that training, and we can flag back to the user that, this is something that you need to look at or that you might want to look at. So it's a real day-to-day useful tool, particularly for those who are organising learning and training within their workplace. Oonagh also mentioned that if you've got an account and it's up to date, you're then eligible to claim workforce development funding. So that is, if you're putting staff through qualifications, you can claim some of that funding back, but you do need an up-to-date adult social care workforce data set account to be able to access that funding. And we've recently released the benchmarks feature, and that is against these 4 key workforce metrics of pay, turnover, sickness and qualifications. This is all dummy data. This is my pretend Skills for Care account, so none of this is real data, but if it was, I could see that I'm paying more than on average in Leeds, that the turnover rate in this area is 50%. As I say, this is dummy data. I can see how I'm performing on sickness, and I can see how I'm performing on qualifications. And this is just our first dip in the water on benchmarks. The way we work is we're developing more features around benchmarks, one being comparing you to good and outstanding CQC providers. But the way we work with the data set is, rather than wait another month or 2 months until we've built everything, we think that's a good chunk of functionality, and we'll make that live and get that and get people using that straight away. So I never refer to Ask WDS as a data collection. I always talk about it as being a service, part of which is, yes, we're gathering data, but there's really useful features in there for care providers, helping them on a daily basis in their business.
Absolutely. And I want to bring up that last overlay if we can. What is the comparison group? So do you put that in? You can decide what you compare to. Is it whether it's other people in your organization or other, I don't know, or a different area, like you said? So you would decide what your comparison group is.
At the moment, and this is our first dip into benchmarks, you'll be compared to someone offering the same main service as you. So if you're a care home with nursing, in the same local authority area as you. So we're comparing care homes with nursing in Leeds with other care homes with nursing in Leeds. It's really important that people are being compared basically with very similar providers to themselves. Otherwise, the data becomes meaningless.
Great. Okay, that's helpful. That does set it. Good. So then maybe we can go back to the report. And I know you've got some kind of summary stats of what it shows us. And I think we can bring something up for that. So do you want to just talk us through some of the main highlights that was highlighted by the report?
Yeah, I've got a few areas to skip through that kind of jumped out to me as we were working on the report. Firstly, just the sheer size of our sector with 1.52 million people. It's larger than the number of people working in the NHS, and that's why it sort of contributes such a vast amount to the England economy. But within those 1.52 million people, we've got 24% of those are on 0 hours contracts. 20, and I always turn the percentages into numbers. So, 27% of people aged 55 and over, that's close to 400,000 workers who may retire over the next 10 years. So sometimes I think quoting percentages kind of masks the fact that means, 400,000 people. In terms of turnover, the turnover rate across social care is about 30%. Right. What I want to say about that is that isn't uniform. So there'll be providers who are experiencing 40%. Equally, there are big chunks of providers who have turnover, around 10 to 15%, the sort of levels you might expect in most businesses. So, there's a real range of turnover across England, and it kind of shows that there are some providers who are doing some things differently that are meaning they have less of an issue with turnover. But what 30% actually means is 430,000 people leaving their role every year. We estimate about 2/3 of those are staying within the sector, so they're moving between care providers. But that still means two things. That still means 430,000 recruitments that have to happen, and all the costs and the training involved in that. And that's just to stay still. And that's just to keep at 1.52 million people. But it also means that 1/3 of those are leaving the sector altogether. That's 140,000 brand new people we need to find every year. And that's just to stand still. So I think that's a real issue that the sector needs to think about.
And I suppose from that, it's almost saying, well, if we can do something within the sector to help people stay in those roles, then you can deduce this from a kind of the information, then that would help rather than having to recycle people all the time. Do you find from the data that it's by area, or is it really random? It's really just by providers. You might have 2 providers in the same area, or quite a few that just some of them have fantastic rates of people stay turnover, and others have different. Or is there like a north-south divide or anything like that?
Not particularly, no. I think you could have 2 large care homes next door to each other, as you often find if you walk down a leafy street somewhere. 2 big houses have been and one might be paying a particular rate of pay, one might really invest in learning and training in their staff, and one might have leadership, and a registered manager who's been in post for some time will also influence that. So it's much more to do with, I think, with what's going on within the workplaces rather than just external factors.
Great. And you've got a slide here about economy summary. I don't know if we can bring that up, and that's number 28. Yeah. So that's a bit. Yeah. Can you talk through this a bit?
Well, so one's just showing just the pure numbers who work in adult social care, and we're a very large and disparate sector, which is why the adult social care workforce data set is so important. Is if you want to know what's going on in the NHS, you just go to the NHS electronic staff record, and they're one big employer, and they've got access to all the information. However, adult social care is spread over over 18,000 organisations, 38,000 different care locations. So it's important that there's one place that we can gather this data so that we can report back to government in the same way that the health sector can. And while we make the case for social care based on it's the right thing to do to invest in adult social care, but there's this alternative argument as well, in that it's actually a very valuable economic sector, and it's worth around £41 billion to the UK economy, the England economy every year.
Yeah, that's a big one for me. I think when I think about you have a lot of conversations with, I don't know, sector leaders in adult social care, and they constantly talk about how much adult social care is costing their bottom line, and not many people go into the conversation about how much we are actually supporting the local economy. And I actually think that's a really important stat, because when you're thinking about how adult social care can actually support the recovery of the local economies within the time of COVID-19, actually by investing and supporting in the sector, it's not just about the immediacy of keeping people alive, keeping people safe, but also giving the workforce money so they can spend in typically local shops in local areas. So that data is actually really interesting.
Yeah, and I mean, I was going to move on to, obviously a lot of that is in the wage bill. And, you know, we know that on average, the median pay rate for the care worker is about £8.50. So all this data's in the report. What we also know is around 23% of care workers are paid the minimum wage. And I do often wonder what it's like to go to work, you know, walking into work, particularly during a pandemic, knowing that, you know, you're literally being paid the minimum that you could be paid. So I wanted to draw that out as one of the things that stood out to me in the report.
Absolutely. And there's been some information, some people rumblings about that, and you hear in the press, but I think it often still gets forgotten in the amount that people feel that is being spent. It's the headlines of the infection prevention control kind of fund, but that doesn't always necessarily filter through to people who are working in the sector. So that problem about pay isn't going away. So really, and that's all in the report, so people can go and dig that out. So there's a few other areas that you could kind of go over before we kind of invite Oonagh back into the stream. Is there anything in particular you wanted to bring out?
The last thing I was going to talk about is we've talked about the real challenge of finding enough workers to stand still. So we talk about we need to find another 140,000 every year just to stand still. We know that around 400,000 workers may retire over the next 10 to 15 years, but then there's just the pure growth that we're expecting in the sector. So up to 2035, we think the sector will need to fill another 520,000 roles over the next 15 years just to meet the demand of a sort of growing and aging population. So you put all that together with we need to grow by 500,000 jobs while finding 140,000 every year just on replacement demand. And I think it kind of boils up to, you know, a real challenge for the sector at a time when we're going through Brexit, and you know, we know around 8% of workers in the sector are EU workers with an EU nationality. So I think putting all those things together really lays out some quite big challenges for the sector.
Okay, that's really helpful, and maybe we'll kind of bring Oonagh back in to kind of unpick that a little bit, because a lot of what Skills for Care does, it does look at workforce and workforce planning and how people might cope with that. And I do wonder with there's always the issue with staffing and how do we get more staff and how do we keep staff. And I know that with the demographics we talked about, there's potentially quite an issue with people wanting to retire, because I don't know if we can bring up the demographics overlay, but yes, the average age of the workers 44 years. So but there are quite a lot of people who will be approaching retirement age, but also you've got, I noticed a statistic around the young people who are coming in are around about early 30s, and that has gone down slightly from like 35 to 32 or 31. I don't know if Oonagh or, you know, either of you had an idea of how we go about attracting people to the sector and how we can keep them in there, because I know from my experience it's really hard to keep people in social care at the moment. I think it may be because there's a little bit more competition with the NHS than there used to be pre-COVID, and we just can't compete with their terms and conditions. They're umpteen months full pay, sick pay, and all of that. And just generally just their hourly wage. Social care just can't compete with that. So how do you see, or I don't know whether the data has got any good examples of how people are able to keep people into the sector and bring in people who are likely to stay?
So Dave will have more detail than me, but I find the predictive analysis really interesting and useful, and because what it allows us to do is to say who is more likely to leave within the first year, for example. And while that's only telling you the problem, it might allow you then to focus a little bit, to focus your solutions a little bit more. So you mentioned young people, Sophie, and you're completely right. We don't manage to keep young people for very long. So we have a 40% turnover for young people within the first year. So people bounce in and they bounce out again. And we'll always have an element of our sector or a portion who don't want a long-term career in social care, and that's fine. We'll as long as they've got the right values, they might stay 5 years and move on. But there's got to be something deeper than that, because we're not keeping enough people. So as well as saying how do we get more people in it, how do we keep them? And one of the things that we do know that is within our control, it is around training and development, supporting staff. It's around having good registered managers. So there's a real link between an experienced registered manager and a new registered manager. So your turnover tends to go up if your registered manager's new. And all that means, I think, for employers is you might just need to put a little bit of additional support in when you know that you've got a new manager in place. Things like 0 hours contracts, as you'd expect. You mentioned terms and conditions, higher turnover if people have a 0 hours contract, but also the more hours that they do, even within that 0 hours contract, the more likely they are to stay. So there's some real variables within that. And when you look at the demographics, there's something quite interesting for me around, so 18% of the workforce is male, and is that a market that we need to be tapping into, understanding what do men think about working in our sector, what do they think about when they hear about our sector? Do we need to reframe some of that and have some marketing targeted at getting more men into the sector? And there's something about the visibility and we know that 21% of the workforce is from a BAME background, but that only translates into 17%, I think, of leaders and managers. And so there's something there that we're not quite getting right, that isn't translating. And so I think a lot of this is about leadership, and there are things that we can do. Dave, I don't know whether there's anything else in the data that I've missed.
No, you know our data as well as I do these days. I don't think there's much. There's certainly, we know what are the sort of predictors of people being at risk of leaving, and it's workers aged under 25 are more likely to leave. Workers who travel more than about 3 miles to work are more likely to leave. Workers who are on certain pay levels are more likely to leave. So I think we have a good idea of what the predictors are of staff being at risk of leaving. But given we understand that, as Oonagh said, can more support be put in, around staff, because we do sort of understand that these are sort of more high risk of dropping out the sector.
I wonder, having, you've got the predictors, and the predictors are in the report, are they? So I don't know whether people can bring up a business case to then go ahead and do a more qualitative type of research on. We know what you've just said, Dave. That's amazing information. Could we then go into organisations and say, from a young person's point of view, what is drawing you out of organisations? I mean, I think we can probably guess issues with progression and opportunities, and like we said, but to put a business case almost to say this is what support we need to keep those people and to make the workforce more sustainable. But I'm just noticing from the chat, there's also Dudley Sayers put up a question about sort of people of colour working in social care. And there was a series of webinars that was done, which I was involved with, and Skills for Care were exploring issues around race and social care and the workforce, and they were really good feedback from that. So he's just wondering from sort of the data that you've got there, do you think this has shown a concern of equality issues in the sector? And will the webinars, BAME webinars, be a permanent feature in the future?
So I think the biggest equality issue that just stood out to me right away as soon as I read the report was around that translation into leadership roles. So we don't have an issue in terms of representation of the workforce in general. It's quite a diverse workforce, quite representative, probably overrepresented in terms of the proportion of people from BAME backgrounds. We've got more than the general population, but that just doesn't translate into leadership roles. And so the webinars, I mean, I've heard amazing feedback from them, and I've obviously watched them, and we are really responsive to what people need. And so the reason we started those webinars was because people were saying that they wanted them, particularly the registered manager networks, and people have found them really valuable. And so I'm still hearing that they're valuable. So I think we'll still do them as long as people find them useful, and always really open to hearing other topics that people would find most useful, because it needs to be things that needs to be topics that people are interested in. But I also think there's an element for me in terms of anything that we look at in terms of inequalities, income inequalities, health inequalities, that will always be, we know this from the social determinants of health, that will always be magnified when you look at pay, and so there's other wider inequalities, I think, in the sector that have. And I'm not sure we understand that enough, and particularly in terms of the qualitative sense, like you were saying, Sophie. So we can see some of the issues from a quantitative sense, but do we have, is there enough research out there around, well, what's causing that, what would change it? So we've done some research with employers who have under 10% turnover. What is it that they do that's different? And so in terms of your previous point, I think we do know some of that in terms of, what actually works. But I think we have a whole unknown area around equalities in social care. We don't have the equivalent of the RES that we have in the NHS, and we don't have an experiential survey, for example, of the social care workforce, which would give us a sense of people's experience and different experiences. So I definitely think we have more to do, and what I think I'm keen to do is to make sure that we're part of that conversation and really asking some of those questions and saying, well, what does that mean? And we're certainly doing that internally. What's the what are all the differential impacts that we are seeing, and what more can we do to bring some of those out? Because I think it's just so key. And my background is equality, so I worked in the Equality Commission, and so that it's a particular. I just think it's. I think it's really. It's something that we just need to grapple with in our sector, I think.
Yeah, absolutely, and. It's good that Skills for Care has kind of kick-started it with having the webinars, with exploring it. Dave, were there anything from your point of view, looking at the data a bit more on that subject? And also, what do you feel needs to be a deeper dive in that area? What could be taken forward?
Well, I think what the Adult Social Care Workforce Data Set does, and the work that Skills for Care's analyst team does, is... But we now know that there may be an issue about progression of brain work. So we probably wouldn't know it was an issue without all the scale of the issue, without the data set and the work that we do. And it's often the thing that creates a question of why. Well, why is that the case? What can be done about it? So I think it's just a great example of how the data set highlights issues, and it's ready for others, or perhaps Skills for Care, to pick up to do some more research in that area, and then we can revisit the data in 2 years to see did it have an effect or not.
Exactly. If you got the data, you got a starting point, and then you can work from there. And like I said, you do this every year, so next year you'll be able to do the comparators and keep on doing that. And I think it just backs up some of the experiences that people are talking about, and that they're saying that they are dealing with within their organisations, if you have the data to also represent that, I think that's really helpful. And then there was some couple of things I'm just seeing if I got the right in turnover. Oh yes, I think it's this one. So this is looking at the roles. This is social care is more than just the care worker. Of course, you've got OTs at the bottom there. You've got registered nurses. You've got other regulated professionals. And this is looking at the turnover, go back again to that. And it's incredible to see where when you do a little bit more detailed analysis of this, where the turnover is, which roles. And care worker stands out. And also registered nurse stands out hugely. But in comparison to social workers and occupational therapists, and then senior managers in the pink there, it's very, very different. So I think that does come back to your point of pay recognition, because we know that in those roles, social workers get slightly different packages to your care worker. So maybe it's that their roles are more secured. So I think that it's an interesting starting point with all this data to then dig down. Yeah, you wanted to comment.
What's interesting on that slide is social workers, occupational therapists, senior managers, predominantly employed by the local authority with better pay, better terms and conditions, a pension, holidays, etc. Whereas registered nurses and care workers that are in the sort of private and independent sectors and probably don't have access to those same benefits, and that's I would argue partly explain why turnover is so much lower in those job roles where you're employed within the local authority compared to being in other parts of the social care sector.
And yeah. I think the chief nurse for social care that's been announced they'll be really interested in the turnover of registered nurses, and I think that will be something they'll definitely want to pick up and lead. So what's going on there? What more can we do? And there's also there's an element of people going through their nurse training, not thinking about social care, not necessarily being having social care in their placements. And so the more we can do to get people, nurse students involved in social care earlier, I think will also be helpful. But I think that leadership from the chief nurse in social care will be really helpful to say, this is such an important role for us.
Yeah, but it sounds like we need to sort out their terms and conditions first, because if looking at that, I wouldn't want to go into a place where there's lots of turnover. But yeah, that's really helpful. And Dave, you said it much better than I would. It's who is employing them, and I'd love to look. We're going to do a whole live stream session, I think probably in December now, around about commissioning, and how commissioning can play a role in the staffing and the terms and conditions that people get as well. If we're commissioning services or not paying enough for services, then it's going to affect how much employers are able to support their staff as well. So really, really interesting stuff, and we've got so many different stats we could bring up, but I would urge people to read the report. But before we go, and if anyone is listening live and you do have a thought, then just do put it in the chat like Dudley did. But I really want to focus on, we talked about a national level, how people can use it nationally. We did touch a little bit on how employers can do it, but I want to explore examples of locally, how I know certain local authorities use different data to look at their city to find out where the needs are. Could you, I think, Oonagh, when we talked before, you had a few examples of how people can use the data that you have. It's not just a written report. We talked about logging in and then drilling down into different areas to get local information. How can people, whether it's providers as well as local authorities, use that data to make better decisions?
So Dave will have some practical examples of how he's working on that now, but the information that we have is available at local authority level, so in that level of detail. And some local authorities will use that to inform their strategic workforce plan for their areas. And so they'll say, maybe we have less of an issue with retention, but more of an issue with vacancies, for example. Or, you know, they might say we're really struggling getting younger people into the sector, so we might focus our attention there. So at a local authority level, I think people use it for use the information for planning, but for shared and joint planning, so that's a wider conversation. I think some local authorities have built it into their data sets completely, so they merge it with some of their other data sets, so that workforce is a part of how they see the sector overall. I don't know, Dave, whether you have a really practical example.
Well, I think in the same way, sort of, without this data, local authorities wouldn't actually know how many people work in adult social care. You know, for example, within Stoke, it's the data set that shows them that this sector's, you've got about 2,500 workers. You know, we think that 30% of those will leave over the next, you know, over the next 12 months. So you need to start thinking about who's going to lay on training for 700 new care workers, and where will you find 700 new care workers? And you don't have to log in. You have to log in to use the adult social care workforce data set to see all the statistics from a local authority level to regional level to national level. You just need to go to the Skills for Care website. No login, just go there and all the information's there. But I did want to mention, you know, to assure people that those who provide data, that their data gets used at the very highest levels of government. So even over the last few weeks, we're talking to the Department of Health and Social Care and Public Health England about, you know, hopefully as and when we get a COVID vaccination, how many vaccinations will be needed within adult social care. If we just want to target residential settings first, for example, you know, how many vaccinations will we need? Or, you know, equally, you can imagine that they might think, well, we'll start with the Northwest. You know, again, how many vaccinations will we need to do that? When Brexit negotiations are ongoing, we were advising to be able to show the government, you know, what effect it will have in London compared to the Northeast in terms of the levels of EU workers. So, yeah, the data gets used at provider level, at local authority level, at regional level, and certainly right up to national level, because we deal with those queries from the Department of Health and Social Care every single day.
Lovely. And if providers want to get involved, maybe they think that you could be looking at different data for next year, presumably that's data collection is just ongoing, how can they feed back to you? Because I know that you're all ears and you all want to do things co-productively. How would they get in touch?
I think one of the slides, you can either go to Skills for Care, but we've also got a specific email address about the adult social care workforce data set. So
yeah, there we are. I was looking for it. That's the one. So people can get in touch, and they can probably email you if they're not getting on with the benchmarking or the website, there's some issue. So that's the information for people to get in touch. And if you're not signed up to the workforce data set and you think actually this would be really useful for my organisation, maybe if you're supported living or another care home, small care home, or anybody else, then that is the number to get started with. And of course, there's lots of information on the website. So yeah, really, really helpful. Before we kind of close off, were there any last remarks or thoughts, reflections that you wanted to mention? Maybe Dave, you start and we'll finish with Oonagh.
No, but I did have a big note to say, if care providers who are listening in who use the service, thank you. Your data gets used. And if you don't use the service and you want to find out more, go to the Skills for Care website. Thanks.
Brilliant. Great. Nice and succinct. Thank you, Dave. And Oonagh?
He's stolen my one, because it is just so important that people both put their information in, but also use it. So I suppose I'd end by saying, if everybody watching this session, whether live or you pick it up later, go in and have a look at your local authority information, and I think then you'll be sold on how useful it is. But do keep talking to us, because we always want to improve, and we really want it to be as useful as possible.
Yeah, and I would third that and say that I am guilty of knowing that it's there and engaging with it a little bit, but not enough. And I actually did talk with our local authority office, and I said, if we pull together some data around about the economic benefit of social care, would that be helpful in you understanding how important that we are and how much you need to kind of involve social care in strategic decisions? And they said, oh, yes, please. So we're actually working with our local Skills for Care representative to put just a short page of documents information, and we're going to draw from the information that you've got in the report and on the website. So yes, hopefully next year you'll have lots of examples of people using the data to make a difference and get a bigger voice in social care. So thank you both very, very much. I've really enjoyed our chat, and hopefully we'll see you again soon for another discussion on something that Skills for Care is doing. You're doing so much. So thank you both very much.
Brilliant. Thanks, everyone.
Thanks a lot. Bye.
So there you go. That was a really useful talk, and I hope that you will watch it back, that you'll share it with colleagues, and that you'll most of all go onto the website and not just fill in the information, because a lot of organisations, if you're in social care, you'll be asked by CQC, by your local authority, by maybe your CCG and other people for information. Very rarely do you realise the benefits of being able to use that information within your organization. It's usually just, you give it, but you don't get anything back. But with this, you not only get funding, but you also get support with information that you can benchmark and everything we talked about today. So do engage with it. And like I said, if there's anything that you feel that they can improve on, they're all ears and happy to work with providers for next time. So that's it from us today. Thank you for tuning in. Share, subscribe, click the bell. It doesn't cost you anything, but it does mean that you'll be updated with what's going on next. Like I said, next month, we're in November now, so December, we're hoping to do a series of live streams exploring commissioning, different ways of commissioning, and how commissioning practices might need to change to help providers, help care workers and people receiving support. So we're going to have a range of speakers. Before that, we're going to be talking to Asha Craig, as I explained, next week, but also I'm in talks with so there you go, there's a bit of information again. But also I'm in talks at the moment, emailing back and forth with the NMC, National Midwifery Council, I think that's what it stands for, because from the State of Care report that CQC brought out, there was some really stark information around the issues around maternity services. And I know it's not strictly what we normally talk about on the channel, but I'm trying to include some more kind of health focused discussions as well. So we're going to discuss why maternity services are failing in a lot of areas, what can be done, what are the impacts. So that might be of interest to you because it's slightly different than our normal conversations. And hopefully we'll have a few people, including some doulas. If anybody knows what a doula is, you'll know by the end of that talk, and some people with lived experience and other things. So get in touch with us if you want to hear us to interview somebody and have a discussion. We also are all ears, but otherwise do take care, everybody, and hopefully we'll see you next week, and if not, at some other time on one of our live streams. So take care now.